Hello, Michael. My name is Skyler. I'm going to be your nurse today. Before I start, I'm going to go ahead and wash my hands for 20 seconds. So I also know you have difficulty communicating, so I just want to establish a means of communication. Can you just give me a thumbs up for yes, a thumbs down for no, and if you're in any pain or discomfort, just give me a raise of hand up high, okay? Okay, good. I'm going to go ahead and finish washing my hands for 20 seconds. Make sure nice and clean. Okay, I'm going to go ahead and look at your wristband. Name is Michael Jordan. Date of birth is February 17th, 1963. Is that you? Yeah? So I also notice you don't have an allergy bracelet on, but I just want to ask if you have any allergies. No allergies? Okay. So today we're basically just going to provide some trach care to you. Have you ever that done before? You have? Okay. Yeah, so basically we're just going to go ahead and suction you. We're going to go ahead and also replace your old inner cannula, put on a new inner cannula. And we're also going to remove that old dressing. We're going to inspect the site, clean the site, then put on a new dressing for you. And then we're also going to go ahead, I'm going to get another nurse to help me change out your stabilizers that wraps around your neck, okay? Are you experiencing any pain right now? No pain? Any shortness of breath at all? No shortness of breath? Okay. So I also took your vital signs this morning, and they were at baseline. But now that I'm looking at it, your O2 sats look like they're at 90%, and your respiratory rate is 25. So I'm going to go ahead and listen to your lungs, okay? So just give me a deep breath in and a deep breath out. I'm just going to go ahead and go underneath your gown. Breathe in. Breathe out. Deep breaths. Breathe in. Breathe out. Okay. Yeah, so it does sound like you have some secretions. So we're going to go ahead and suction and proceed with the trach care, okay? Do you have any questions or concerns before I proceed? No? Okay. So I'm going to go ahead and check your emergency equipment before I start. So you have an extra inner cannula. You have an extra suction catheter. You also have one trach of the same size and one trach that is one size smaller. You do have a suction catheter connected to suction at 120, and you have an ambu bag connected to 100% oxygen. I'm just going to go ahead and test if it works. Okay, looks like it works. You also have an oxygen source, which is on and running and is connected to your trach, which is good. So now we're going to go ahead and prepare my table and supplies. So I'm going to perform hand hygiene for 20 seconds, put on some clean gloves. And we're going to go ahead and wipe down the table for 30 seconds. I'm going to wipe down the table for 30 seconds. Make sure it's nice and clean. I'm going to go ahead and wipe the edges as well. Make sure everything's nice and clean. Okay. I'm going to go ahead and throw this in the garbage. I'm going to go ahead and remove these gloves. Throw these in the garbage as well. I'm going to let this air dry for 2 minutes. While I'm letting that air dry, I'm going to go ahead and close the privacy curtain. I'm going to raise the patient up to a high Fowler's position. Are you in a comfortable position right now, Michael? You are? Okay, that's good. I'm going to go ahead and prepare my supplies on the table then, okay? I'm going to wash my hands for 20 seconds, put on some clean gloves. So we're going to go ahead and put all our supplies onto the table. So we're going to grab our supplies. So we have some sterile saline, inner cannula, a stabilizer, a new suction catheter, and a trach care kit. So we're going to go ahead and first replace this old suction catheter because I don't know how long that's been there. We go ahead and replace that one first. So just go ahead and grab that, throw this away, put on a new one. Connect it to 120 suction. I'm going to put that back on there, like so. And now we're also going to go ahead and take out the sterile container. So we're going to be careful and not touch the inside of that. Put that down like so. And we're going to go ahead and open our trach care kit, like so. And we're going to go ahead and grab the sterile gloves that we don't need. And we're going to go ahead and grab the sterile drape carefully at the edges, like so. Just make sure just touching the edges there. And shiny side down. Perfect. Now we're going to go ahead and get our inner cannula. We're going to go ahead and drop this in carefully like that. Throw that away. Going to open sterile saline, put it into the tray, and put it onto the container. Good. I'm going to go ahead and close that. Now I'm going to remove these gloves. Perform hand hygiene for 20 seconds. Okay, Michael, we're going to go ahead and hyperoxygenate you because your O2 sats are low at 90%. And then we're going to suction you after. But we might have to hyperoxygenate you again, depending if your O2 sats are still low after the suctioning, okay? So we're going to go ahead and hyperoxygenate you and perform hand hygiene for 20 seconds. I'm going to put on some clean gloves. We're going to remove your O2 source device. I'm just going to hold down your faceplate. Remove that, like so. Now we're going to go ahead and give you 3 breaths, okay? So I'm going to hold down this faceplate, and I'm going to give you 3 breaths on this ambu bag connected to 100% oxygen. Okay, we're going to give you 3 breaths. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. I'm going to hold down the faceplate, remove the ambu bag, put this aside, hold down the faceplate again, put on the O2 source, like so. So it looks like your oxygen sats are now 98%, which is good. So we're going to go ahead and proceed with suctioning, okay? So I'm going to go ahead and prepare the suction device. So we're going to go ahead and test if it works. And we're going to go ahead and test it and get some sterile saline. Alright. We suction some sterile saline. I'm going to go ahead and put this on just here so I can remove your O2 source device. Okay. Alright, so we're going to go ahead and hold this down, remove the oxygen source device here. And then we're going to grab our suction. We're going to take out about an inch or so. And then we're going to go ahead and advance this in for 3 seconds. And then we're going to suction out for 7 seconds, okay? So once we put this in, you might cough. And then we're going to go ahead and suction it out, okay? You doing good, Michael? Good? Okay. Let's go ahead and start suctioning then. So I'm going to insert for 3 seconds. 1, 2, 3, and then okay. Put this, actually, we're going to go ahead and rinse this first. Perfect. Alright, now that we have that there, I'm going to go ahead and close this with the oxygen source device while holding your faceplate. So how are you feeling, Michael? Good? Good. I don't hear any secretions that much, and your O2 sats are still 98%, which is good. But if we did have to resuction you again, we would have to wait 30 seconds to resuction you. So right now, we do not need to do that because your O2 sats are still 98, so that's good. I'm going to go ahead and remove these gloves. Perform hand hygiene for 20 seconds. Okay, Michael, now we're going to go ahead and remove your old inner cannula, put on a new one, You're gonna remove your old dressing, clean the site, inspect the site, and put on a new dressing for you, okay? All right. So I'm gonna go ahead and perform hand hygiene for 20 seconds. Put on some clean gloves. All right. Okay, Michael, we're gonna go ahead and put on remove the old one and put on a new inner cannula. You're gonna hold your faceplate, remove the O2 source device. You're gonna hold down the faceplate, remove the inner cannula, the dirty one, and then we're gonna grab the new one, just by the wings, like so. And we're gonna go ahead and put this in carefully, and then clip it on. Perfect. You're doing good, Michael? Good. Okay, we're gonna go ahead and remove this old dressing then. It's all dirty. Throw this away. We're gonna go ahead and inspect the site. Looks like there's no redness or swelling, no infection. It is a little dirty, so we're gonna go ahead and clean it up for you, okay? All right. So I'm gonna go ahead and grab one swab, put it into the sterile saline. I'm gonna swipe once from the bottom, toss this, grab another one, like that. Put one into the sterile saline. We're going to swipe once from the top and throw this away. Then we're going to grab a gauze, dip it in sterile saline. We're going to wipe once under, throw it away. Then we're going to go ahead and grab another one, dip it into sterile saline. Wipe once from the top. And then we're going to go ahead and grab another one, another gauze, dip into the sterile saline. And we're going to go ahead and wipe around the faceplate. Make sure it's nice and clean, like so. Toss that in the trash. Then we're going to get a dry gauze. We're just going to pat around the surrounding skin and dry out the faceplate areas. Okay. Then we're going to go ahead and put on a new split gauze. Attach it on, like so. Getting the faceplate. Make sure it's on here. Okay. There we go. Okay, now that's on there. Gonna hold down the faceplate, put on the oxygen source device, like so. We're gonna go ahead and toss this away. I'm gonna also toss away this Retake kit because we don't need it anymore. We're gonna leave the sterile saline and the sterile container just in case we have to resuction you again. So we're gonna go ahead and remove these old gloves. Perform hand hygiene for 20 seconds. You feeling okay, Michael? Good? Okay. So now, that's all that's left is to actually change out your stabilizer. So I'm going to go ahead and call another nurse to assist me with that. So we're going to go ahead and call another and change your stabilizer. But before that, I'll check your vital signs. Your O2 sats are 98% still, which is good. Respiratory rate is 16, which is good. So I'll be right back, okay, Michael? I'll get another nurse. Hey, Michael, we're back. I'm here with my colleague, Nurse John. Say hi, Nurse John.
Hello, Michael.
We're going to go ahead and remove your old stabilizer now and put on a new stabilizer for you, okay? All right, perfect. So me and Nurse John are actually wearing a face shield and mask, which we need. We're going to go ahead and perform hand hygiene, both of us, for 20 seconds. And then we're going to go ahead and don clean gloves, both of us. As so. And then we're going to go ahead and replace your stabilizer with a new one. So I'm going to go ahead and secure the faceplate and remove the oxygen device. Now Nurse John is going to secure the faceplate, and I'm going to go ahead and remove one side at a time. And we always remove one side at a time and put on one side at a time. So while he's holding the faceplate, I'll remove this side. I'll tuck it underneath for him to grab. I'm going to do a quick neck assessment. There is no signs of swelling, redness, or infection, no skin breakdown, no drainage, which is good. So now that we remove that, we're going to go ahead and have Nurse Sean still hold the faceplate while I grab a new stabilizer. I'm going to go ahead and throw this in the trash, the packaging, and Nurse Sean is still holding the faceplate. I'm going to go ahead and put one side at a time of this stabilizer, like so. Like so here. And then we're going to lock that, and I'm going to go ahead and give this to Nurse John. Now it's my turn to hold down the faceplate, and Nurse John will remove the old stabilizer one at a time and then put on the new one. So he's going to remove this one, as so, and then he's going to throw that in the garbage. He's going to go ahead and do a quick neck assessment on that side.
No redness,
swelling, no signs of infection, no drainage. Perfect. I'm going to go ahead and put in the new one. As so. Perfect. Now I'm going to go ahead and make sure there's 2 finger space here, which is good, so it's not going to be too tight around your neck. So now I'm going to go ahead and secure the faceplate, put on the oxygen device like so. Alright, that wasn't so bad, right, Michael? Perfect. So now I'm going to go ahead and look at your vital signs. You have respiratory rate of 16, oxygen sat of 98%, which is good. Are you experiencing any pain, shortness of breath? No? Alright, perfect. I'm going to go ahead and do a quick check on your lung sounds, okay? So we're going to give me a deep breath in and out, okay? Breathe in, breathe out, 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 breathe in, breathe out. Alright, so you do not have any, you have clear breath sounds, which is good. And you also have a new clean suction catheter in place, which is good. I'm going to go ahead and give you this call light, which you can use to call me whenever you need anything. I'm going to go ahead and dispose of this container and the normal saline into that garbage, like so. And then I'm going to go ahead and remove my clean gloves, throw this in the garbage, perform hand hygiene for 20 seconds. Then I'm going to exit the room to document the date and time of the procedure. I'm also going to document the tolerance of the patients, which he tolerated well. I'm going to document the site assessment of the neck and the trach, which showed no signs of redness, swelling, or infection. I'm also going to document the color, amount, and consistency of the sputum, which was thick, white, and clear with moderate amount. I'm also going to document the vital signs of respiratory rate of 16, O2 sat of 98%. And I'm also going to document the respiratory assessment, which the patient had no shortness of breath and had clear breath sounds. And that's it. Bye-bye.